Hello, my name is Lisa Otto, and I'm the manager of the Simulation Center in the skills areas. We have all different types of simulation. They range from emergency room admissions all the way to hospice care of the death and dying patient. And then as that patient progresses through different levels of care, we have different room setups to mirror that clinical environment so that we're able to have a medical surgical room as well as be able to set up a home health environment. We also are able to span the life care of a patient from a geriatric patient to a pediatric patient. We want the simulator to mimic the patient condition as closely as possible. If the patient is supposed to sweat, we want the simulator to sweat. If the patient's respirations are supposed to be 28, we want difficulty breathing. We want it to sound like there's difficulty breathing so that that student nurse experiences what does a patient sound like when they have difficulty breathing.
Mr. Shapiro, do you have any problems breathing? Are you having problems breathing?
I do feel a little short of breath.
Okay.
There is not a clinical instructor next to them telling them what to do. The students are critically thinking through the process of providing care. So whatever the student chooses to do intervention-wise, then that care progresses on. And the patient then will experience whatever the side effects, the adverse effects, or the negative outcome of the intervention the student has chosen to do.
5, 6, 7, 8, 9, 10, 11.
And we utilize debrief to minimize patient negative outcome and to maximize the positive outcome of the patient. When they work here in simulation and they practice their skills and they repeat those skills, they become comfortable and confident with their communication with patients, with their implementation of the procedures in the clinical environment. They're also able to recognize clinical manifestations of disease or of complications earlier. West Coast provides the students with an amazing opportunity to grow their critical thinking skills, to learn to care for patients, including assessments, interventions, and being able to extend that care to all types of patients in all different communities. And the Simulation Center mimics those community situations right here on campus in a safe environment where the faculty can facilitate simulations and work with the students to learn how to assess and prioritize patient care.